Having someone who shares common interests and hobbies, as well as personal goals such as health and fitness, may be important for a lasting relationship. So, how about the idea of finding a primary doctor who's a great match for you?
Your perfect match might live in Nebraska, right? It's perfect for you. This doctor's like would have been your best friend had you met in person. And that person might live in Nebraska, but it's really a new category of healthcare.
Guy Friedman is co-founder and CEO of SteadyMD in St. Louis. He wants people to know they don't have to be limited to the doctors in their zip codes.
We're a technology platform which allows patients and doctors to develop long-term personal relationships between each other.
He developed the idea from professional and personal experiences.
The doctors actually want to build a relationship with you, but the system doesn't allow it. And I found the process really disappointing in terms of wait times, the time you get to spend with the doctor, and the whole system is designed around this idea of when you get sick, we're available. But what I really was looking for was a relationship with the physician for the long term that I could interact with and develop almost a friendship and a trust with. And I didn't really see that product out there.
Through the SteadyMD platform, Friedman says a 90-second quiz will generate a match.
You submit criteria about your lifestyle, your health, your diet, any conditions you have, exercise habits. And we take our database of doctors, and based on what you've clicked on and told us about yourself, we find doctors that are perfect fits for you.
Then once you start,
you have a 1-hour video call with that doctor. So you get to know them, they get to know you, and really develop a trust and relationship on that call. And then from that point forward, you have access to that same dedicated doctor.
The idea is taking off. Friedman says there's a growing need for virtual healthcare. And right before the pandemic, the startup raised $6 million to expand. Friedman believes everyone can benefit. One example is the connection between athletes and doctors who both know the sport and goals.
It's like, I can talk to this guy. He understands me, understands my culture, my lifestyle. And his goal in life is not just to get me out the door with some generic advice.
Dr. Scott Soris is SteadyMD's medical director. He's board certified in family practice and works part-time as an ER doctor in Missouri. He enjoys the opportunity to help patients like Linda Richmond, who live in remote areas. She's in New Mexico.
Also, I have a handful of patients that live in Alaska, who are hundreds of miles from any nearest healthcare facility.
When a physician becomes part of SteadyMD, how does that kind of open up the world for them when it comes to their ability to reach and help even more people?
We have a physician who's a runner, a physician who's a triathlete. We have a handful of physicians who do CrossFit. And so then they're able to reach out into those communities and offer their medical services and advice and expertise in those areas. And have a much larger impact than if they just, were trying to reach out to runners just in their local geographic area.
As an ER doctor, Sori sees a lot of people who wish they had guidance before showing up. Through SteadyMD, he says he can help guide patients who aren't sure if they need urgent or emergency care.
Go ahead and send the picture in the chat program.
With the immunosuppressants that I take, that's a bit concerning.
Yeah, I agree. That looks enough concerning. I think we should probably get you set up with a specialist to get a biopsy.
The doctors also order prescriptions and lab tests.
Part of the blood test will check for the blood sugar, and that's only a 6-hour fast.
Online visits are not processed through insurance. Instead, patients pay a monthly fee for unlimited interactions.
Our vision is very unique and disruptive. And I think it's a huge idea that is global. It's a universal need to connect with a doctor and have a relationship with them.